All right. Hello, everyone. My name is Zuhair, and welcome to Doc on the Phone. Today, I'm with my co-host, special guest, Mr. Saad Salaf. And today, we're going to be asking our special guest, Dr. Muhammad Suhail, about his specialty and how he got into medicine and everything about that. So I thank you for joining, and we're just going to dive in right now. So, I'm Dr. Suhail. I'm going to start off with a biography about you, and then I'm going to give the definition that the AMC, or the Association of American Medical Colleges, has about your specialty. And so you're kind of in two specialties, so I'll give the definition of both, and then we'll move on from there. So, Dr. Muhammad Suhail is an internal medicine specialist in Plano, Texas. He graduated in 2013 from the University of North Texas Health Science Center, TCOM. He completed his residency in internal medicine and was a chief resident at the University of Texas Health Center at Tyler. Having more than 7 years of diverse experiences, especially in internal and perioperative medicine, Dr. Muhammad Suhail is affiliated with many hospitals, including Texas Health Presbyterian Hospital Dallas, Medical City Plano Hospital, Texas Institute for Surgery and Presbyterian Hospital, Texas Health Center for Diagnostics and Surgery, and cooperates with many other doctors and specialists in the perioperative and transitional medicine group. So, Dr. Suhail, I also want to ask you about you. You also went to UT Dallas as well, right?
Yes. So yeah, I was at UT Dallas. By the way, there's five more hospitals you didn't mention. I'm just kidding.
Okay. Sorry.
No, I'm just messing with you. Yes. So I grew up in Richardson. So I went to Berkner High School, and then from there I went to UTD and I did 3 years of biology, and then it was from 2004 2007,
Okay.
and yeah. So
Gotcha. Okay. Awesome. Now I'm going to dive into the definition of specialties, and then we'll go on from there. First of all, Dr. Suhail is an internal medicine physician, so I'll read the definition for that. So internists are personal physicians who provide long-term comprehensive care in the office and the hospital, managing both common and complex illnesses in adolescents, adults, and the elderly. Internists are trained in the diagnosis and treatment of cancer, infections, and diseases affecting the heart, blood, kidneys, joints, and digestive, respiratory, and vascular systems. They are also trained in the essentials of primary care, internal medicine, which incorporates an understanding of disease prevention, wellness, substance abuse, mental health, and effective treatment of common problems of the eyes, ears, skin, nervous system, and reproductive organs. And internal medicine physicians' primary responsibilities include health maintenance and disease screening, as well as helping patients who are undergoing surgery, obstetrics, and family medicine. An internist's work is categorized by extensive knowledge and skill in diagnosis and treatment. So that was the internal medicine definition, and now I want to move on to the perioperative medicine definition. So the definition is: perioperative medicine is the medical care of patients from the time of contemplation of surgery through the operative period to follow recovery, but excludes the operation or procedure itself. So, Dr. Suhail, is there anything you'd like to add or subtract from either your biography or your definition of specialties?
no, I think the specialties is very thorough. I mean, the definitions you got from AMC, I think that includes everything. Just the biography part that I would mention is, after I finished college. So, I mean, we'll get into this detail. I mean, I finished college in 3 years, but the reason I finished in 3 years was I was trying to rush towards medical school.
Yeah.
And so I kind of stumbled along the way because I was just going so fast. I was literally doing summers and winters like nonstop. It was, I think, right after high school. That first summer, I went to Richland College and I did history 1 and 2, and I think it was like government 1 and 2. So I got over those 4 courses, and then straight to July UTD starts, and then winter course, and then the spring ends, then summer, then it was just like until, and even I think the last May when I graduated, because I graduated in May. I think I may have had a summer course before graduating. Yes, I think I did some. So I didn't graduate with the spring class. I graduated with the summer batch, and it was not only me, but I had a few friends that we all kind of like. So it was like continuous nonstop. But I mean, I was just going too fast. But after I finished UTD, I actually was an SAT prep tutor for 1 year. I taught at C2 Education Center in Capel. And then after that, I taught 1 year at Plano East Senior High, the high school down the street. I was a physics teacher there for 11th and 12th graders, and it was a lot of fun.
Mhm.
And then I was alhamdulillah, I was able to get into medical school, and then here we are.
Awesome. Okay, thank you for that.
You're welcome.
So the first part of our question revolves around your journey to medicine specifically.
Mhm.
So our first question is, what drove you to become a pre-med and pursue medicine?
So the medicine part, I mean, I initially, I was born in Bombay. My parents are from India. My dad's from Hyderabad. And so in India back in the day, I mean, the 90s, I'm sure still the day, I mean, when you were as a kid, you had basically two options. You're either going to be a doctor or an engineer, right? That's kind of was force fed into your head. My parents didn't really force me into medicine, but I remember just as a kid, I was like, okay, one day I have to, like, these are the two professions I'll be choosing. It's funny because this was like when I was 5 years old. I still remember this. There's like some Indian movie was playing on the TV or some TV show, and they were showing like heart surgeries, and no one would know what the heart surgery looks like. They have this fake stuff, and they're like, look, heart surgery. And I'm like, man, I have to memorize this right now, right? Because this is what I'm going to be using, when I grow up. Um, but when I came here, I mean, I had the option of doing whatever I wanted to do. I came here, I was about 13 years old. But for me, I just wasn't too passionate about anything else. At that point, even the community was at a different place than it is now. Like nowadays, you see kids doing a lot of hifz and learning the religion, and there's other doors that are opening up. Back then, like in '99, this wasn't the focus back then. It was just a different focus. I guess the community was still growing. People were coming to US and just kind of learning and growing, and so that just seemed like the safest path for me. Even through high school, I wasn't too passionate about like math or any other kind of field to pursue. So I kind of had in my mind like the medicine part is what I needed to kind of focus on. And I mean, biology was not that difficult for me. I felt I could memorize, alhamdulillah. So I just said, let's just pick this. And then when I got to college, there were other like-minded folks that I was able to kind of be around, and that also helped my journey as well.
Right. So our next question is, how was applying to medical school like? And reflecting back on that process, are there any tips that you would give that you think would really help with the process of admission?
So for me, like I said, when I was rushing through college, like, back even 10, 15 years ago, there wasn't YouTube like it is now. There wasn't there weren't people out there that would really help guide the youth. Nowadays we have, alhamdulillah, we have like doctors coming forward. We have sessions at our local masjids or other places. You can really go for guidance. And a lot of the physicians, you have to realize, were from India and Pakistan. Even now, if you look at the bulk of our community physicians, they've all been trained. They did their residencies in India and Pakistan. And so very few of them actually have done medical school in here. Now that batch is obviously growing, but if you look at the amount of doctors we have, majority of them are from India and Pakistan, and they're all in their late 40s or 50s or even older than that. So people going to American medical schools and actually talking about the whole process were very few back then. So when I went to UTD, I was like, I said, I'm going to rush through this process. So I basically finished college in 3 years. But then what happened was that when I was doing the summers, winters back to back to back, I didn't really have time to prepare for the MCAT. I wasn't, that wasn't something that I was really thinking about. So when I started taking my MCAT, I was taking my MCAT even before I've completed my prerequisites. Like I think for MCAT, you have to have OChem 1, OChem 2, Physics 1, Physics 2. And some of those twos, the second part of the course, I wasn't taking those. I jumped straight into the MCAT just because of the speed I was going in. And so I had to take MCAT a couple of times because there simply wasn't time for me to study the MCAT like a full summer. What you really need to do good on the MCAT is you need to basically have one whole summer set aside studying for MCAT only. For me, I wasn't doing that. I was MCAT on top of a summer course, and a summer course at a college level, there's a lot of information. They basically condense the whole semester down into 1 to 2 months. So really, studying hard. Plus, you've a lot of times, the tuition is extremely high for summer courses. So you want to make sure you're making an A. If you're paying all this money, you don't want to come out to B or C. So I think with my focus being at the college and now the MCAT, the MCAT helped cause me to kind of stumble a little bit. But I think it was a blessing in disguise in the end, because I honestly wanted to always stay away from interest and loans when it came to medical school. But I had no plan as to how I was going to do that. So God made a plan for me where the MCATs were the plan. Basically, I didn't do so good on the MCAT, so I had to kind of wait. And during that waiting period, I worked as the SAT prep tutor for 1 year, and then Plano East as a science teacher, and then alhamdulillah, I was able to save close to 60K those 2 years. And then when I went to med school, that helped me with the finances of it. And then the way I wouldn't spend a single penny of that on anything. Like if I, barely would hang out with friends at a restaurant like that, all of that money was going straight into the bank account. I was obviously living with my parents, so alhamdulillah, all the food and rent was provided by them. So it's because of their duas I was able to get here. But yeah, I saved every penny, and even in med school, I didn't go overboard. We had 3 roommates, but I think I'm going way past what you've asked me. So we'll get to that eventually. But as far as the application process, the first thing was that I wanted to be close to home. I didn't want to go to the Caribbeans. Some people can do that. I felt if I went to Caribbeans, I might lose my faith. Like because the halal food scenario was completely different. Even in Dallas now it's changing a lot, right? You have so many halal options. You go back 10 years, there's not that many halal options. Like halal pizza, halal burgers were kind of rare. So imagine going to the Caribbeans with, no halal options, and I don't have a lot of family in America. And so I was like, man, if I go to Caribbeans, I don't know what's going to happen. So I was like, I don't want to go anywhere besides Dallas. So I think that the MCAT part delayed me, and alhamdulillah, I was able to get into UNT Health Science Center. There were other med schools in America that wanted to interview me, but they were out of state, and I didn't want to leave the state. And so this being in Fort Worth, only a 15-minute drive from home, I think it just worked out for the best.
So I know you kind of touched on this before, but maybe if you'd like to elaborate. So why did you choose to pursue the route of becoming a physician instead of, like, for example, any other healthcare provider, such as a nurse or physician assistant?
That's a good question. To be honest, when I was applying, I really did not even know about nurse practitioners and physician assistants. Like I said, back in the day, we just didn't have people providing us a lot of information. I honestly knew about NPs or PAs after I entered medical school. And actually, NPs I knew after medical school. PAs I knew during medical school, because my medical school also had a PA program, and I was kind of surprised because I had never heard of what a PA was. And the doctors that I worked under in the community, like at INT clinic and stuff, you don't really see NPs or PAs come there. So I never actually run across them. I mean, I knew about pharmacists and dentists, but those weren't fields that really, for whatever reason, attracted me. Maybe I just wasn't around too many pharmacists. We have a few doctors in our family back in India. So that's one of the reasons why I was like, okay, I have to be a physician as well. Now, let's say if my family had a lot of pharmacists or dentists, then it might be a different story. So a lot of it had to do with influence from within the community, from outside the community, from family influence. That kind of made me, in the medical field, choose becoming a physician rather than a different field.
Okay, so our next question relates to the COVID-19 pandemic. So what advice would you give to pre-med students now during this pandemic in helping them gain experience or learn more about the field of medicine?
With this pandemic, the biggest thing is if you are in high school or college, and I'm sure most of your audience are, I would tell them to make sure their grades are high. They work hard on their grades because your opportunity to shadow people is going to be less. Like in a lot of hospitals, they're not wanting people to come over because of COVID-19. They don't want, number one, the kids to get COVID, and two, they don't want the kids to pass along COVID, let's say if they have it, to a nurse or a physician or a patient worse, because that could lead to a lot of issues. So we don't have many observers in the hospital, very few, in fact, if any. So I know those opportunities are gone. So now you basically, what can you do to boost up your resume? It basically comes down to your GPA and MCAT, and it has always come down to GPA and MCAT. Everything else is just extra. If your GPA and MCAT are great, everything else is just cherry on top. Even if you don't have that much shadow experience and your personal statement isn't the best, whatnot, you'll still get into a very good school. When your GPA and MCAT are not good, then all these other things really count. Your personal statement, your volunteer hours. That's the first thing they look at is what is the kid's GPA, MCAT, and of course there's an interview process. They want to make sure that they're talking to a normal person, right? It's not like a robot or somebody who doesn't have any social skills. Because I've seen sometimes people who have had really high MCAT and GPA, they may have not had the best social skills, or they're very awkward during their interviews, and so because of that, they've got rejected. So that's what it comes down to. But going back to your question about the pandemic, what they can do besides the MCAT and GPA and focusing on their curriculum and their grades, do what Zuhair does, or what you guys are doing. Find virtual clinics. I mean, there are clinics like Epic out there, I'm sure, or with any local church or mosque, any religious institutions that are actually doing clinic for the uninsured population. And I'm sure there are other avenues where you can volunteer. So just nowadays you have so many resources, right? Back in the day, we didn't have all these resources going online. And I mean, of course, we had internet back then. I'm not from the Stone Age, but they're definitely, it's much more publicized now compared to compared to like 99 or like 2005. So just look online. The one thing I would say, just stay ahead of the curve. Don't wait till your junior year or your senior year to look for shadowing and volunteer opportunities. Start trying. Let's say you're a freshman right now at UTD. Don't wait till your sophomore year or your junior year to look for opportunities. Start looking for them now, because you might be busy during your junior year, but your class load might be much more heavy or much more rigorous, where you have to spend more time studying and you have less time shadowing or volunteering. So take advantage of that during high school years, your summer breaks, your winter breaks. Utilize your time and don't waste it. I think that's the biggest key. Start early and utilize the time you have before it's crunch time and you are doing too many things at once.
Gotcha. Thank you for that, Dr. Suhail. That's really valuable advice that you gave us. So that mostly pertained to the pre-med side, where you're trying to climb over the wall of admission for medical school. But now I want to transition to once you're over the wall and into medical school. I wanted to ask you what your experience was like at UNT. And a lot of people say that medical school is like drinking water from a fire hose. So I wanted to take your take on that. And I was also wondering how the experience was different from UTD, your experience there. How was it harder, or was it a different style of learning? And if you're going to give advice to a first-year medical student who's just about to start, what would you tell them and why?
So, the biggest misconception that I always heard was, once you get to med school, that's it, you're done. You're going to be a doctor. You're set. Just get into med school, you're set. But once you went to med school, you realize a lot of people, not a lot, there are a few people that don't come out of med school. So like at UNT, for example, my year and the year above me, and I think that's pretty much the average for every year, but I don't want to state that because I haven't looked at any of the reports or anything like that. But I'm definitely, my year, 10% of the people failed out. And the year above me also, 10% of people failed out. When I say 10%, sounds like a big number. I mean, you're looking at from 200 kids, 20 leave for whatever reason. But I think most of them leave because they failed 1 to 2 courses. I think once you fail the second course, that's how it was at UNT. Now, I'm talking about 2009 to 2013. 7 years have passed, so things may have changed. But I remember that if you had failed 2 courses, you had to pretty much repeat the whole year, and no refund. So that $20,000 that you just paid, it's gone. And so some people, that happens. And then also, just jumping the gun here, but during residency, once you become a resident, they say, that's it, you're a doctor now. But then I've also met people, luckily it didn't happen to anybody in my class, but it did happen to a few people in the class above mine, where 2 of them were let go for whatever reason. Now, it's much harder when you get dismissed from medical school because of your grades, or you get fired, and definitely much harder if you get fired from residencies to get back in the medical practice, because that's like a big red flag on your resume. And all of these things are being tracked online, right? So it's not that you can hide it from somebody, especially residencies, because residencies, the way it works is Medicare pays for the residency. So There's a portal where all of your information gets stored, which residency you're going to, what disciplinary action gets taken against you. So it's not like you can just go to a different residence in a different state and just kind of lie about it and you get in. They can just pull up by your social security. They know everything that's there. And even as a physician, you would think, that's it. I'm a physician. I finished residency. I'm good. No. But one thing I realized is, alhamdulillah, I've been on the good end of this, that if you mess up as a physician, you can get sued. You could hurt a patient. It could be a big liability. And that could also hurt you because now when hospitals are hiring physicians, they don't really want to hire physicians or surgeons that have had a lot of complications with their patients or they're found to be liable. So you always have to make sure you're doing the right thing. So the one thing about going back to a question of medical school, residency, or being as a physician, there's never a moment that says, alhamdulillah, I'm set. No one can do anything to me anymore. I'm going to be a physician forever. I can do whatever I want. No, it doesn't work that way at all. But as a medical student, so your question was about medical student, and then what was that again?
So like the first question, part of that question was, if a lot of people say that going to medical school is like drinking water from a fire hose.
Oh, yeah, right. Yeah. There is a lot of information that gets thrown at you during medical school. That's absolutely true. The first 2 years are basically classroom setting. That's how UNT was for me. You're in classroom, 5 days a week, literally. And the way UNT had it set up, now every med school is going to be a little different. UT Southwestern is going to be different. For us, a course, like let's say in high school, right? A course in high school will last about 1 year. You have 2 semesters of it, but it lasts a whole year. A course in college usually lasts a semester. A course in med school for me at UNT would last about 2 weeks. So there's a lot of information that gets thrown at you, 2 to 3 weeks roughly, maybe 4 if it's like a really long course, but it can vary, but definitely less than a month for all the courses. I never had a course that went on more than a month. Most of them were 2 weeks. There's a lot of information. And the thing you have to realize is with these 2 to 3 weeks, there are like 1 to 2 quizzes and there's 1 or 2 tests. If you do really bad in one of those quizzes or tests, your grade is really screwed for that particular course. There's really no coming back. You really have to do really good on the other test. So like in high school and college, you can mess around with a few quizzes here or a few tests there and still come out with a B or maybe a low A. It's very hard to do that in med school. You can't repeat the course. And if you fail one course, let's say this course was 2 weeks long. Let's say, God forbid, somebody failed this course. The next course is also 2 weeks long. You failed that course. That's it. 2 strikes, you're out. So in a month, basically, you're done. And that actually happened to one of my very close friends. The very first course, I think, the first test, maybe he didn't take it too seriously and he didn't do too good. And he ended up failing the very first course. And then I think he got good. He did okay in the second, but the third one, he basically didn't do it again. And he was out within like a month and a half of med school. I mean, that's just traumatizing, right? You spent tons of money, got an apartment, you went there, and now you're out because you just weren't focused. So with med school, you have to have a lot of discipline. So I think that's also one good thing. Maybe that's why God didn't put me right into med school right after college, even though I felt I was focused, but maybe I wasn't as focused as I should have been, because in college, you can still dilly-dally and play around here and there. In med school, it's serious business. So I don't think I was maybe that much mature enough to handle that kind of course load. And I don't think many people realize. So that's why whenever I give talks about medical school, I tell them to pick classes that are going to challenge you, pick a major that's going to challenge you. Don't go the easy route. So the one school I always pick on, I'll mention it here. I'm sure some people are going to hate me for doing that. UNT have their own, the UNT college, not the med school. The UNT have their own like a 7-year program. It's not technically a 7-year program. It's like a 3-year program. And if you get into med school, then med school is 4 years long. But there are programs out there where you're guaranteed to come out as a doctor. UNT is not one of them, but regardless. So in the UNT program, they make you do biology and this Bachelor of Arts. And I think initially, they've changed this, but initially it was, if you get into this program, you don't have to take the MCAT. So they were making it very easy for the students. So one thing I would always tell people is they're making it so easy at UNT with you do biology of arts and no MCAT, you're never going to be challenged. And then they're going to throw you into med school. where this is going to be like a huge mountain that you've never faced before. It's just going to set you up to fail. So that's what I think. And one of the ways to prepare for it is always trying to challenge yourself. So let's say you're in high school, you take the pre-AP and the AP classes. Don't just stick with the regular courses. You challenge yourself. In college, maybe you take you don't have to do summers and winters like I did, but you can, when you're taking the 15-hour course load, you're making sure you're trying to get that A, or challenge yourself with a different major. One thing, if I were to do it all over again, the part you asked about med school and what would I do differently, it wouldn't be necessarily med school, but in college, I was a biology major, which I regret. But like I said, back then, everybody was doing biology major for medical school. Looking back now, I would do like finance or something where I learn about the stock markets, for example, or learning about Bitcoin, or all these other things that once you become a physician, you realize, man, I don't know anything about any of these things. And that's where like the future is, not biology, because biology degree, I do absolutely nothing with that. That was just like a stepping stone to get to med school, but that doesn't do anything for the rest of your career. It's of no benefit to anybody. Like, alhamdulillah, I was able to utilize that to become an SAT prep tutor and a high school teacher. So I guess it did help me out in that regards. But if I were to do it all over again, I would have done like something in the finances or something, that way I understand money more, because they don't teach you this stuff in med school. They don't teach you this stuff in residency. They just train you how to be a doctor. They don't teach you how to set up your own clinic, your own practice, how to run everything. They don't teach you any of that. So I think that would have been more helpful to me during college.
Awesome. No, that's really insightful comment and answer that you gave there. Because first of all, this is the first time I'm hearing about how difficult medical school is from that aspect of 2 strikes you're out. In the how many people actually drop medical school because of how difficult it can be. But thank you for that. Now I want to transition to your own background, specifically at UNT. So UNT, for anyone who doesn't know, is a osteopathic program. So I wanted to ask you how different the osteopathic program is from the allopathic program, and if you had any skills like or special knowledge or any hurdles that you had to overcome while you're in that program. And did you think that the extracurriculum that you learned at the, UNT helps you to this day in your day-to-day with patients?
So why did I pick osteopathic? I wasn't necessarily picking it over allopathic schools.
Mm-hmm.
It just happened to be the only other medical school in town, right? It was just Southwestern and UNT.
Yeah.
And with me having some difficulty getting over that MCAT issue, I didn't think I was going to get UT Southwestern because they typically want their MCATs to be very high. And even though my GPA was really good, the MCAT was an issue. And I just went through college so fast without focusing on the MCAT. And so it ended up becoming UNT. But I mean, when you're applying for the process, they tell you, why do you want to pick osteopathic or allopathic? You just make up a reason like, man, I just love osteopathic so much. It's like the best thing ever. But in reality, you're just like, dude, just get me into medical school. You have no idea what that means. But in the end, it's exactly the same as an allopathic school in terms of the material they teach you. Some things may be different, like the way they structure out their classes, the way they structure out their grades. But that's from any medical school to any medical school. That has nothing to do with allopathic or osteopathic. You don't stay like an extra year in med school or anything like that. They just teach you everything exactly the same. All the knowledge you need in an allopathic school, they teach you in an osteopathic school, vice versa. The only thing additional in an osteopathic school like UNT is that they teach you one extra course. There's one extra course that allopathic schools don't teach you. And that is OMM, Osteopathic Manipulative Medicine. And in that, basically what they're teaching you is, instead of treating everything with medication. So let's say you've been playing basketball one day and you pull your back, right? You go to some doctor, the doctor's like, okay, here you go, take some Tylenol and ibuprofen, and I can do this to your back, and I can give you this medication. So rather than just going straight to medications, or let's say you have a sinus issue and you're having a lot of drainage, you go to a doctor, and doctor's like, okay, I'll write you some sinus medications. Well, medications are there, that's great, but what else can we do, that can fix that? So you can use osteopathic medicine to kind of like fix your sinuses. So there's techniques you can do to kind of open up your sinuses to get the drainage flowing properly. And that actually helps a lot of people. I actually had a neighbor that had those issues, and I would just go to his house and just kind of spend like 30 minutes with him, and just he would lay down, and I would just work on his face and his uh, cheekbones and whatnot, just to get his lymphatic flow going properly, and that would really help him out. You know, I mean, it would help him some, but of course, he would need some medications as well. But that, for a few days, for like a week, he'd be in a really good condition. And same thing with my parents. My mom pulled her back or something like that. Instead of just giving her Tylenol or muscle spasm medication, I could actually go in there, do like deep tissue massage or like deep tissue, fascia opening, and really gets her shoulder moving or back moving the right direction. And so they teach a lot of stuff of how to fix, a back that's locked, for example. Medication is not going to help it. I've seen issues. I've seen patients in clinics, not my own, but an osteopathic clinic where I think he was a mechanic or a worker. He came and he had pulled his leg, and this guy was barely able to walk into the clinic. And we basically lined him, put him in bed. We lined him up. We realized that his one leg appeared to be shorter than the other leg. That was causing a lot of issues. And we fixed his back. And, like within 20 minutes, this guy was able to walk out much better than what he came in with. Whereas if he went to any other physician, they would basically, let's say he went to an allopathic physician, right? They would pretty much start with an x-ray of the back. If it's still hurting, we'll do a CT of the back. Here's some pain medications. They might give him some stretching exercises they found online or they have there, but they wouldn't work on his back per se. They wouldn't know what to kind of open up or how to kind of, fix the back, or what kind of muscle techniques to do. So that's one thing that osteopathic school teaches you. And they have a really good book that pretty much summarizes all the techniques. I used to do a lot of it during medical school, a little bit during residency, not a whole lot, but the type of practice I am now, there's very limited scope for me to do that. And so once you stop doing that on a regular basis, just like anything in life, you start forgetting those skills. But I have the book. If I need to ever go back to kind of review them, it's there. But honestly, I haven't done any osteopathic stuff on any of my patients in the past probably like 3 years. But it's a good technique to have, or a good, not technique, I should rather, a good knowledge base to have in case you ever need it. But unless you're in a private clinic practice where you're seeing a lot of primary care patients, you advertise yourself as an osteopathic physician and doing those techniques, it's hard to kind of do those procedures on a day-to-day basis with your patients.
Gotcha. Thank you for that and all the honesty you brought into that answer. I wanted to ask you, besides taking the USMLEs, the osteopathic program also requires you to take an additional test called the COMLEX. Could you talk a little bit about that?
Yeah, so they have COMLEX and they have the USMLEs. So as an osteopathic physician, the good thing is you can apply to you can take both tests. You can take the USMLE and you can take the COMLEX. And you can also apply to allopathic residencies. So even after med school is done, there's allopathic and there's osteopathic residencies. Going to a DO school or an osteopathic school, the good thing is you can apply to either residency. I applied to an allopathic residency, but I could have applied to osteopathic residencies too. So I have a lot of residencies. Like the channels for me to apply to different residencies opens up a lot. Whereas an allopathic student, he cannot apply to an osteopathic school because they simply won't take him because he doesn't have the allopathic knowledge. I mean, he doesn't have the osteopathic knowledge, whatnot. So they're kind of limited. And the thing is, osteopathic residencies, they don't take foreign graduates. So you can't come from India and Pakistan, for example, or Poland, or apply to an osteopathic residency because you don't have the osteopathic base. You have to be a DO to apply. And there's really not a lot of people that come from India and Pakistan are DOs, if any. I think they're all MDs. So less people are competing for the DO residencies. Now, there was some talk a few years back about how they're going to merge all the residencies by next year or the coming year. So I haven't really kept up with that because, I've kind of moved on from residencies, but that's some of the things they were talking about. But going back to your question, yeah, I mean, I did take the USMLE and the COMLEX. I later found out I didn't have to take all the COMLEX like I initially did. I think I could have just taken the first one and not taken the second one. I didn't ask the right people that because I could have saved a lot of money not taking the COMLEX because I was never interested in applying to an allopathic or osteopathic residency. The reason being, you look at where the residency is compared to the area you want to live at. So let's say you want to be in Dallas, for example. You look at what residencies are in Dallas. Now, the osteopathic residencies aren't that many, so you may not find a lot of osteopathic residencies in Dallas. They may be somewhere far away. So based on that, you're already like, okay, I don't want to do this residency. So then you don't necessarily have to take your complex 2 or 3 or how many. I think there's 3 complexes. And that's why I just focused mainly on the USMLE scores, because I knew they had a lot more residencies in Dallas and around Dallas, and that's where I wanted to be.
Gotcha. Okay. So I know I already kind of asked this question before, but if you want to just mention anything else or anything else came to mind, you can add that. But I just want to ask, what is one thing that you would do differently if you went back in time? And is there anything you regret doing? So I know you mentioned the biology degree and you'd switch it out for something else, but is there anything else?
I think that would probably be the biggest regret. Not regret, I mean, because I mean, back then it's not like I knew any better or I was being told any better. It's just if I had to go back in time, that'd be the one thing I would definitely do. I would definitely do something in finance or understanding how business works, or securing an MBA. Even I think you need more than that just to, but something of that sort would be different. I would probably not finish my college in 3 years like I finished, but I mean, this is all from Khadarullah. It was meant to be. Had I done the 4-year traditional route, I may have got into medical school straight away and then be stuck with loans right now. Who knows? But with the way it happened, so that I think take your time, finish your college in a timely manner. Make sure you have enough time to study for the MCAT is the advice I would give everybody. But besides that, med school is tough in the sense it's a lot of information, and you get kind of overwhelmed with it. Not only overwhelmed, you just get kind of tired. I think rushing through college in 3 years and then working the 2 years and then going to medical school, it was a lot. So I think after the first year of med school, mentally I was like checked out. I was like, I don't really care anymore. I just want to pass and just move on. And especially like years 3 and 4, I was chilling a lot. I was just mentally exhausted. And then with our culture, until you finish your med school and you have a residency, have a job, you're not getting married. So you're just like, and so you're kind of stuck in that regards. At least the girls, they can go to PA school or NP school. Typically, I mean, back in the day, I guess, or even now. But even now, you don't have a lot of guys that are doing P and NP school, right? It's mainly it's the guys going to medical school. Oh, and one other point, I know I'm going completely off the topic. There's not a lot of Muslim guys in medical school. At least they weren't there in 2003 to 2009, 2013. So we definitely need more youth going to medical schools. We definitely need more physicians. And people will probably say, man, there's already so many Muslim physicians out there. Why do you need more? But if you look at the bulk of the Muslim physicians, like I said earlier, they're all older physicians that came from India and Pakistan. Once they get older, even older than now, and they start retiring, you're going to see a huge drop in the Muslim physician population. And, all the physicians that are giving donations to the masjids and doing this for this, there's going to be this big void. Of course, Allah Subhanahu is the one that provides all the funds, but I'm just saying that we definitely need more Muslims in every field. And the thing is, we need good Muslims in every field, not just the medicine field, but that's the key. You have to be a good Muslim. You have to be a good person, good Muslim, all of the above. But yeah, I mean, I think just the rush of it kind of messed me up. But besides that, I wanted to do internal medicine, and as to why I picked internal medicine over anything else, I just, after the second year of med school, I was so checked out. I just wanted to do the least amount of residency I could possibly do. And there was ophthalmology too. I think that's like 2 years of residency, but that was like really competitive, and I wasn't really gung ho on doing that. I just kind of wanted to do internal medicine. I was deciding on internal medicine and surgery. For a while, I was thinking of doing surgery, but surgery is like 5 years long, and depending on what kind of surgeon you want to be, there could be additional years to put in. And I knew I didn't have the time commitment to do that, or I wasn't that focused of being a surgeon to do that. So internal medicine was, and here we are. And then the pathway, and I'm kind of going blah blah blah, I'm just like going on, but I'm sure you guys probably will ask me this later or have questions on the side. The perioperative medicine is not actually, it is a specialty, but you don't actually take a test or anything to specialize in it. It's something I just kind of fell into. So after I finished my residency, I was a nocturnist for 2 years. I worked at Dallas VA for 6 months, and then I was a nocturnist is basically a hospitalist that works at night. So my shifts were 7 p.m. to 7 a.m. So I did that 2 years. Now, nocturnist, why did I pick that? Because right after residency, I was having a hard time getting jobs in Dallas, but Tyler was having opportunities for me, and that's where I was doing my residency anyways. And so the night paid a lot more than the daytime. So I was like, if I'm going to be away from my family, I'd rather just pick something that pays me a lot more. So that's how I ended up becoming nocturnist. That's only something you can do for a few years, because that's living that way is going to tire you out very fast, and especially if you have family. So after that, I found a job opening at Perioperative Internal Medicine Group, and I wasn't really even. I never thought I was going to be this kind of physician, but mainly our group, what we do is we basically see patients before and after surgeries, and we see them in the clinic before surgery, get them all cleared, and then after surgery is done, we follow them in the hospitals, and then we also follow them in inpatient rehabs where they get their rehabs, or skilled nursing facilities, or long-term assisted care, where let's say they're healthy enough to discharge, but they need like IV antibiotics that they can't get at home, or they need a lot of wound care, or they're still intubated and they've been intubated for days, or trached or whatever. And they're stable, but they need to be moved out. So that's called an LTAC, long-term assisted care. And so my group kind of focuses on that. So I didn't necessarily pick that specialty. The kind of medicine that I do with perioperative clinic, there's probably less than 10 physicians in the whole DFW area that do this. I mean, they're mainly internal medicine physicians. They're probably doing a lot of hospital, but they don't necessarily focus. Their focus is not necessarily perioperative medicine like my group's focus is. So that's how I kind of fell into it. But yeah, going back to your question, no, I mean, besides biology and just rushing through it, there are really no regrets, and I'm glad where I ended up. I think Allah subhanahu wa ta'ala brought me to the best possible place.
So that actually leads us into our next question for this part, which is like, could you tell us the story of how you chose your specialty, including the struggles, insights, and like if there was an eventual aha moment where it all kind of connected and made sense? And adding on to that, did you always imagine that you would be in this specialty, or were there certain factors that guided you while you were in medical school?
I mean, internal medicine, like I said, was basically the quickest. I didn't want to. So there are a couple options when you do a 3-year resident. There's ER. ER is, Dr. Ababi, that the first physician you guys interviewed. It was just too much high pace for me. There's a lot of volume of patients and doing a lot of things. I'm not like an adrenaline guy, so I wasn't initially focused on doing that. Second was family medicine, where most of the family practice physicians, they have their own clinic, they're set up. I really like the hospital setting, seeing the patients and then discharging them after a few days, and then getting a new patient, fixing them. And what happens in a hospital setting, it's like solving the puzzle. When the patient comes in, the ER doctor admits to you, then you have to kind of figure out, okay, what test to order. Especially when I was a nocturnist in Tyler, this was great because I was pretty much like, you don't have a lot of help at night, so you have to kind of figure out a lot of things by yourself. And then when you're calling a specialist, you better have a really good reason of calling them, because they're waking up, they're annoyed at you. So during the daytime, it's easy. You just shoot them a text and they just come by and they see, and they're all happy about it. But at night, they're just like, what? Why are you calling me? What's going on? So sometimes you want to avoid making that phone call, so you do as much as you can on your own. So with internal medicine, I felt it was more like a puzzle, where a patient comes in and I have to figure out what's wrong with him, what test to order, what treatment to start him on, things of that nature. And if there is a concern, what specialist consult, and kind of go from there. So, and also the other 3 residencies are like if you're doing like pediatrician, but I wasn't too focused on being a pediatrician ever. So that didn't ring for me. So I think internal medicine is kind of landed up by default based on what I like doing. And as like I said, perioperative medicine just completely happened by chance. 2018, my son was being born, and I was working in Tyler. My family was in Dallas, and I said, okay, time to move back. And I just looked up, like Indeed.com, job opportunities, and this perioperative medicine thing showed up on there. And the interesting is that they said that you're going to see mainly patients that are pre and post surgery patients. And one thing in internal medicine is the easiest patients are the pre and post op surgery patients. They're like, because they're usually fairly healthy. They have a cardiologist that has cleared them for surgery. especially as a nocturnist, there would be two of us at night. So what we would try to do is try to get before the other guy would get there to kind of get the easy patients, because there would be like a list of patients kind of waiting for you. It was funny because me and this other guy were getting so competitive in getting that early patients. Our shift would start at 7 p.m. There were days we were coming to work at 5:45 p.m. Oh, it was getting nuts, and I think the other guy kind of just gave up. He was much older than me, and I wasn't. And my family was all in Dallas, so I didn't have anything better to do. So I was like, fine, if he wants to keep playing this game, I mean, I'll play this too. So there were times we're coming at 5:45 p.m. I mean, that's like way too early to get a hold of those early patients. Like our shift wouldn't start for the next hour and a half, and we'd just be sitting there with a stack of patients to get the easy ones. But to get to your point, the reason we would do that is to get a lot of this pre-op and post-op patients, because those were the easiest patients to get. And so when I saw this job opportunity open up in Dallas about pre-op and post-op patients, I was like, these are the patients that we basically fight over for during nocturnist time. So if there's an opening here, I'd be happy to. And then, what happens is back in Tyler, these patients were like my most favorite patients. Now, when I came here, everybody, one thing you realize is, as a physician, or I think in any field, you want to do the least amount of work and get paid the most amount, right? So when I was getting even like the easy pre-op and post-op patients here, even let's say I've seen 20 patients, fairly easy. Pre-op, post-ops don't take much time. Now let's say give me one more patient, I'm like, my God, one more patient, right? It's like a big deal. But in Tyler, if I had like pre-op, we would like kill for that patient. But now, I've like lost the I don't know what to say, but I've lost like the importance of getting those pre-op and post-op patients, because now that's all I do. So I was like, one more patient, you get annoyed by it. But so I just kind of fell into the specialty. Alhamdulillah, it just works out because it's fairly easy. My work schedule with this particular specialty is I go in. I think you're going to ask me this question, so fine, I'll just wait for a question then. But yeah, that's kind of how I fell into the specialty.
Okay, awesome. That's great to hear. So obviously I want to transition to how life is like for you as a doctor now. So my question is, what does a typical daily, weekly, or monthly routine look like for you? And you can answer whichever one of those timeframes is most conducive to you answering the way you wanted to. And I wanted to ask you what a typical patient looks like and what a typical outcome for a patient looks like.
Yeah, so one thing, now the only reason I'm going to go into a tangent here is because I do a lot of talks and I tell people about, different parts of the medicine, and me having lived the nocturnist life and the internal medicine and working at the VA, like 3 different settings. People always think once you become a doctor, alhamdulillah, that's it. Money, man, just rolling in money 24/7. That's how it is. Big car, big house, it's everything fancy. But becoming a physician, let me rephrase that. As a physician, your life can be very busy, depending on where you are in your life. You could, let's say you've been in the field for many, many years, then you could dial it down and spend more time with family. But a lot of times, if you're a hospitalist, you're working 7 days a week, like 7 on, 7 off. I don't know if you've heard that term. Or sometimes you do 10 on, 4 off. So you work 10 straight days, you get 4 days off. Or you work 7 straight days, 7 days off. Obviously, the more you work, the more you get paid. But those 7 days or those 10 days in a row, that's a lot of work. You could be there from 7 in the morning to 7 at night, admitting patients, discharging patients, and that takes a heavy, heavy, heavy toll on you. That's how nocturnist was for me. We didn't have 7 on, 7 off back then. Sometimes I would work 16 shifts in a row, right? Like 14 shifts in a row, depending on what the schedule looked like. So, and for me, it didn't matter because Tyler, alhamdulillah, was paying like tons. Like they were literally paying tons. So for me, I was like, bring it on, man. Inshallah, I'll do it. But now things have changed with the economy and all that. I remember when I was leaving, they were going to change around the schedules and cut down the pay and all of that stuff. Even the VA was very different. And so that can really take a heavy toll. And I often see people get frustrated with their job. I mean, they're still earning like 250 to 300K, but they're just tired of just going on because, one patient could have like 10 problems. And now you're having to fix that one patient's several problems that they have. Then you go to the second patient, same thing. And you have 15 of those patients on your list out of 20. And by the end of the day, you're just working so hard, just thinking, and it's just not the patients, right? You have to call the family members, tell them, call the specialist, coordinate the care, get everything set up. And if something doesn't happen, they'll start blaming you, because internal medicine is kind of like the quarterback of the entire patient's care. I am the one that drives the care in terms of who to consult. I'm the one that initially starts the blood, get the antibiotics or IV fluids before. I don't wait for the specialist to come and do it, because the specialist might come in tomorrow, for example. They may not even come in today, so I'm not going to wait for my patient who's already very sick to just sit there till the specialist sees him. I'm going to start on some kind of treatment, and that's what's appropriate. So those things take time, and if you have a lot of busy patients like that, you get frustrated. So after 2 years of nocturnist, I was like, I'm done, because I could literally see the frustration on my colleagues. They wouldn't show it to me, but I know, because I was close to my boss and Tyler, and he would tell me that how the other physicians are like, literally shouting and this and that, and then they would yell at the nurses. And so what happens is, a lot of times when you get frustrated like that, you start taking your anger out on people that you shouldn't be doing that on, like nurses or the patients, and then you get in trouble for that. And that's like, so it's like you just spiral downhill from there. And one thing I realized in medicine, people don't wait to complain. One strike, they're like, time to complain. So you got to be very careful as to what you say, how you do, how you interact with other people, your patients, your nurses, all of the above. But for me now, perioperative medicine, it's fairly easy in terms of my schedule. There are days when I go early morning, right after Fajr, like 6:30, 7 o'clock. And then my day is done by like 1 o'clock or 2 o'clock. I do 7 days. So I basically do Monday through Friday, and then I work 2 weekends. But some of the days I go early morning and I'm done by like 11 or 12. But that's only because of the kind of specialty I am in right now. Most of my patients are surgery patients, meaning they come in, they've been healthy because we saw them in the clinic, and after surgery, we're just kind of managing their blood pressures or the diabetes. So we're not really doing a whole lot. And the surgeon just kind of keeps them after surgery, gets them rehab. And when they're doing better, they go to home or inpatient rehab or skilled nursing facility to recover more. So that really makes it easy. Now, if I had a patient that had a lot of medical issues going on that I'm diagnosing and treating, that could really overwhelm me. But my current practice, we don't do too much of that. So luckily, it doesn't overwhelm me at all. And it's easy. I can just go work, see. There are days I've seen 40 patients, but the reason I was able to see 40 patients and be still done at a fairly early time for a 40 patient is because the complexity of the patients was really low. I'm not really doing a lot. The surgeon or the surgeons are doing most of the care. I'm just making sure they're stable, their vitals and labs are looking good. I've ordered some of the as needed medications for them. They're reviewing the labs, and just giving the green light for discharge. But if I was to drive the entire care of the patient, then that would just overwhelm me, and then I would start thinking about leaving. So that's why physician burnout is real. That does happen. People, after working in the medicine field for X amount of years, not even like 30, 40 years, I'm talking about 10 years, 15 years, they want to leave. They want to do something else. And that's the thing. I go back to the major you pick, because let's say you did a biology degree like me, right? After 10 years, I want to do something else. I can't do anything with the biology degree. But if I had a finance degree or something else, I could fall back on it. But a lot of times physicians kind of work their way, and then they save up enough money and start doing investments and learn different things along the way, different, trades, whatnot, and then go from there. But that's what my typical day looks like, is leaving early morning, coming home early, working 2 weekends a month. And the 2 weekends are fairly easy because I have nurse practitioners that work under me. So even though we go to multiple places, like you had mentioned, I only cover like the major hospital, Dallas Presbyterian Hospital. My nurse practitioner covers the inpatient and the skill. They cover the inpatient rehab and the LTAC, long-term assisted care. These are places where patients have to be seen on a daily basis. Before we had all nurse practitioners, I was the one doing all of that on the weekend by myself, and my partner would do it when it was his turn. But having the nurse practitioners really has helped us out a lot.
Awesome. Thank you for that.
So what would you say are the most exciting aspects of your specialty, and what are the most mundane parts?
Mundane parts. I don't know if there's any mundane parts. A lot of it is copy and paste. That's what medicine comes down to as an internal medicine physician. Like in ER, I'm sure you see, every patient has a different thing going on. But as internal medicine doctors, most of the patients are going to have high blood pressure issues, diabetes, some heart issue or lung issue. So there's a lot of repetition, but repetition is good because you get stronger and stronger in that particular field. You don't have to think much about it. And so you are able to provide the care quickly without utilizing too much time into researching and thinking about it too much. You can really start doing steps 1, 2, 3, 4 on a quickly basis. And sometimes time is money when it comes to patient care. And so not a lot of mundane part. The part that I don't necessarily really enjoy, which every physician should be doing, is calling the family and then spending time with the family. That just because it takes a lot of your time away because they ask a lot of questions. But it's important. I mean, physicians have to call the patients, and have to call patients' families. There's no doubt about it. It's just we don't always make the calls, so families get frustrated sometimes, and it's gotten a little bit more of an issue during COVID. Before COVID, it was fine because the patient's family would be in the room with them most of the time, so they're right there to answer questions. You didn't necessarily have to call. But now because of COVID, a lot of families are not able to come to a lot of these places like the LTAC or inpatient rehabs, and there's going to be like one family member allowed, even in the hospital setting. So now you not only have to explain to this family member, you have to get on the phone and explain the same exact conversation that you just had for 10 minutes with this person to, X, Y, and Z over the phone. So I think with COVID, there's a lot of phone calls that definitely taking place. A lot of people doing telemedicine. That's a different issue. But yeah, calling patients' families has become an issue because we don't typically think, oh, we have to call this patient's family. And then the supervisor or somebody will say, hey, by the way, they really want you to call. And then for some reason, they'll always leave it for Friday when I'm trying to rush through the whole thing. They're like, oh, this patient's family really wants you to call. And I'm like, okay, great. I already have like all these patients and I have to call and I have to go for Juma namaz. Like, that's the best time you could tell me. So that's the mundane thing. But honestly, the whole part of I think the best part is when you get a really sick patient and you do all you can and then they get better. And you say alhamdulillah, and you feel a little bit good about it. And you just as a physician, I think I try to do my best in every scenario. I don't get overly excited or happy when a patient does good. It was meant because I know at the end of the day I did my best, and if there's a bad outcome, there's a bad outcome. It wasn't in my hands. So regardless of the outcome, I do my best. I get the right people involved, get the patients on the right medications. If they're good, well, alhamdulillah. I'm not too overly happy or excited. It was meant to be, but I'm happy for them. And if it doesn't turn out to be good, I'm not too overly, I'm not like depressed or anything like that. It wasn't meant to be. I did everything I could. Time to focus on the other patients and move along.
So the next question is, what is the biggest challenge facing your specialty, and where do you predict your specialty will be in the next 10 to 20 years?
My specialty is very niche. Like I said, very few people just focus on perioperative medicine. To be able to survive in this specialty, you need to have a lot of connections, because the way my specialty works is particular surgeons who hold their patients, they have to tell me, hey, I want you to follow my patients and only you. I don't want to give my patients to anybody else. So you need to have a lot of those physicians for your practice to be successful. So you have to have a lot of networks, a lot of connections. And alhamdulillah, before I got there, my partner, who had been doing this for 15 years, he had built a lot of connections, and we were able to kind of grow off of that. But for somebody who, let's say, is an internal medicine physician and says, okay, from tomorrow or next year, I want to be a perioperative physician, it'll be very hard for him because he can't survive on one surgeon, right? It has to be like 10, 20 surgeons giving you patients and trusting you with the process, and seeing how you do with their patients. And sometimes the surgeons don't want to do certain things. For example, they don't want to do discharge summaries. They don't want to send pain medications. They want you to admit the patient, even though it's technically their patient. So they're all different in the way they approach their patients. So you have to be ready for the change. You have to be malleable to kind of doing what different physicians want. You also have to have a good front office setup, because I by myself or my partner by himself or even together, we won't be able to keep up with the surgeons. And when the surgeries are, you have to have an office set up. You have to have somebody calling the physicians' offices, their surgery coordinators, getting the surgery schedules, That way, beforehand, okay, on Monday, or so January 4th, there are these many surgeries that I have to go and check out on the day of surgery at the hospital. If I don't know the schedule beforehand, I wouldn't know where my patients are, where the surgery is taking place, what kind of surgery. So we have to have a team behind the physician. So it can be like a 1 or 2 man show. It has to be an entire team calling and coordinating. So this is not something you can just set up in one day. It takes time, effort. You have to have your own office. It has to be a private office. But yeah, that's how it is.
Gotcha. Now I want to transition to the last part of our interview where we talk about giving advice for long-term career planning. So my question is, what is a career mistake that either you or some other physician that you know has committed, and you would warn us against? And what is something that you or another physician has done well that you'd like other people to emulate if they become physicians?
One thing is, don't ever be arrogant as to what you're doing, no matter how good of a physician you are, because that can lead to mistakes, or it can lead to certain comments or actions you may do that could hurt you down in your career. Starting off from medical school, till college, no one really pays attention to this. But once you join medical school, you have to make sure there are no red flags against you. So you're not doing anything inappropriate in a public setting or in a private setting. Regardless, you're conscious of yourself, how you act on others' behaviors, because everything can get reported, and people have in medical and residents at least have been fired from it, or even from as physicians if they have done anything inappropriate, they can get fired from their jobs. Or sometimes I've heard of physicians in Tyler, not necessarily in Tyler, but there's a small town there. There was just one physician. He kind of ran the place, you could say, because he was like one of the main physicians there. But I guess that kind of got to him because he thought he was better than everybody else, and he would frequently yell at the nurses and whatnot. The other physicians didn't really know about this, but what happened was maybe he yelled at one too many nurses, and the entire nursing and the entire hospital. There's a small hospital. It's like in Palestine or some small town in East Texas, Kilgore, I think it was. The entire hospital, the nursing staff went on strike. They said, until this physician gets fired, we're not coming back. It was like a big deal. So never take your white coat for granted. Never say that, okay, this is, position of power, and that's it. Once I become a physician, no one can touch me. I can do whatever I want. That's the worst kind of attitude you can have. That kind of arrogancy and that kind of behavior, it will even if you feel it, it's going to manifest in your actions, in your words. So you need to check yourself first, make sure and know that you're not above anybody else. Everybody's out there to work hard. Don't be yelling at the nursing staff, because nurses really are a very valuable team. Part of the team, I should say, rather. Without their help, the physicians would be completely screwed. So treat everybody like you would want to be treated. Be good to your patients. Nowadays, a lot of times you always hear horror stories about how physicians said X, Y, and Z, and there was a camera in the room. And nowadays we're living in a cell phone age where everything gets recorded, and there's a hidden camera, for example, or there's a recorder in the room that no one knew. And then, this has happened so many times where you heard about patients undergoing colonoscopies or surgeries, and the patient and the surgeons or the doctors were making fun of the patient, and then it gets leaked, right? And now everybody knows what this surgeon is or the doctor is. So at all times when you are in a professional setting, act like you're being monitored, because even during residency, everybody was monitoring the residents. My director should say, I have camera everywhere, 360-degree camera, he would call it, that everybody's reporting to him. The nurses, the janitor, for example, anybody wanted, they could report you for anything. So you have to really be careful, because a lot of people can, basically report you in the sense they can just tell somebody, hey, this person is not acting right or something, and that can eventually get to the director or whatnot. So just be humble. You're given a position of power and authority, of respect, and I think you should respect it, not abuse it, and that way you can help the community, help the patients, and you should be a role model in every sense of the way. Hopefully I answered your question.
Yeah, no, that was definitely a good answer.
One other thing I think you had mentioned this about career opportunities. Once you become a physician, there are a couple other pathways you can go. You can go into administration, where not early on in your career, but down the road, you can, become like physician advisor or something. Those career paths kind of open up for you depending on your experience. They definitely don't want the new graduates to be part of that. They want you to have like X amount of years of experience and be respected before you can go into administration. Or there's academic positions that open up where you become teachers or faculty members of a medical school, or even you're part of the academic part of the residency, where you're part of the teaching, and you might get an extra stipend. Because at the end of the day, no one wants to do extra work unless either they really love that extra work or they're getting paid for that extra work, right? And then the third is private practice. Eventually, a lot of like internal medicine doctors that I know, they want to just have their own clinic and just have their own business. That way they're in charge of their own financial well-being and not being told what to do. Their schedules are not being made for them. They can kind of make their own schedule. So they can either, once you pick a field, down the road, you can go into administration or academic or private practice. These are the kind of things that kind of open up down the road for you.
So now for your closing statement, what is one thing you would like to say to people who are just starting their journey to become a physician?
One thing is, if you are going to this field, don't go it for the money or for anything else. You really need to love the field, because you have to realize it is a long pathway. And when it becomes more difficult in medical school or residency, if you're not into it, you might just want to quit or just leave. And that's a lot of wasted time and effort. So realize it is a long pathway. I mean, if you think about 4 years of college, 4 years of med school, that's 8 years right there. Minimum, you're looking at 3 years of residency. Unless you want to be a neurosurgeon, that's 7 years, right? So minimum 3 years. And then and it depends on what kind of field you pick. The incomes are going to be different. And it depends on where you live as well. So sometimes there are physicians that make, 170 to 190, depends on the specialty they have. And also after residency, realize if you want to be a specialist, there's 3-4 more years you have to put into that specialty. So let's say you're a nephrologist, a kidney doctor, you do 3 years of internal medicine. Now you're doing 3 to 4 years of specialty in nephrology. The 4 years, like really highly advanced. For some people do that. Typically it's 3 years. So count all those years, 4 plus 4 plus 3 plus 3. That's a lot of years, right? By that time, there are people that are already balding by that time, right? That happens. So you have all these rich doctors that are now driving their Lamborghinis, but they have no hair. But it is what it is. I mean, that's one thing about medicine is it's a long path. So if you really you have to love it to be in it. Don't go after it for the money. Go after it for the right reasons, because otherwise it just becomes too heavy of a journey. If you really want to be in the medical field and not go through all of that, now you have the PA programs that are opening up, physician assistant, which is really nice, because you still get to make 100,000 or more. 120, I think, is what they usually start off with. But you only do your 4 years of college and 3 years of PA school, and you're set. So you don't have the 4 years of med school and on top of that 3 years of residency and then 3 years of fellowship or any of that. But again, there's different goals, right? I mean, the PA, you do earn less money, but you're done with it quicker. And then the good thing about the medical field is, no matter if you're a PA or a physician, you kind of hold the keys to your future in your own hands, in the sense that if you were to leave one job, the job opportunities are always there for PAs and doctors. Like when I left Tyler, or when I was thinking about leaving Tyler, I knew I would get a position in Dallas or somewhere. I would have to sacrifice the money, but it was going to be there. And typically the other fields don't have this, right? Once you're in a position, like my dad, for example, he was a travel agent or travel counselor, but it was going to be difficult for him, if he wanted to leave that, to find another opportunity in town to have at least a similar income, or those opportunities may only come once in a while. And so there are a lot of fields where you don't have that opportunity to just leave when you want to and just do what you can, just take a break, for example, for a year and then come back. It doesn't always happen. But in the medicine field, at least you have that option. In any kind of medicine field, well, dentistry, psychiatry, to be a pharmacist or a PA, NP, all the above. One thing I always like to mention, I always tell is there's 2 things you need to do in life to be successful. The second is hard work. And the first I always say is be religious, because all my entire journey I've been through, number one, wouldn't have been possible without the dua of my parents. And alhamdulillah, with Allah SWT guiding me to the right path. Just like example, like I told you about the college and the 2 year gap in the med school, and then having, $60,000 in savings and avoiding interest and loans completely. I did not make any of that plan. It just happened. And similar, there are other things that happen. For example, when I was in Tyler, I think we had mentioned this briefly. Physicians do sometimes get hit with lawsuits and whatnot, and sometimes it's not on their fault. So let's say, for example, you take care of a patient, and you did everything right. That patient has been in the hospital for, let's say, a month or 2 months now. Somewhere down the second month, some physician comes and does something wrong, and something bad happens to the patient. Now, when the lawyers go after, they don't go after just that one physician that made the mistake. They go after everybody. Anybody that's ever seen the patient, their name gets put on the lawsuit. And so even though you know that nothing's going to happen to you, but there's that stress of dealing with that issue. It's just like a car accident, right? Once you get in a car accident, even if it's not your fault, it's a big headache. You have to call the cops, you have to have the insurance work out, you have to buy a new car. It's just, you have to go through a big hassle. So that's how it is. So I remember one night in Tyler, the way our call schedule worked was I would answer the calls for patients for any patient-related issue that were already admitted from 7 p.m. to 12 a.m. And from 12 a.m. onwards, I would take on new patients that were coming into the hospital that were being admitted. And so we had just switched phones, me and this other physician, because there would be two of us. And so at 1 o'clock, a call comes in, and luckily it was his turn. It wasn't my turn to answer patient calls from the hospital. And we were so busy at night. Like I said, there's not a lot of help. You're kind of doing a lot by yourself. And he, I guess, may have not paid as much attention to the issue like he should have. And some bad outcome happened to the patient. And this physician was basically, there was a lawsuit filed against him and all the people that were part of the team. But had that call come in 2 hours earlier, that would have been my name on there, right? And it luckily it didn't happen to me, it happened to him. But like I said, there are these small issues that if you're not doing the right things and there's no one protecting you from above, you can really be screwed as a physician. And that's true in every field. So that's why I say always try to be the best person you can be a good Muslim, really, because you never know what Allah subhanahu wa ta'ala is going to protect you from. So that's really the only thing I have to say is work hard, be sincere, only follow it if you're passionate about it. If you feel there's other fields you like doing, do that instead. Don't go after just because your parents want you to do it. Because I've seen people that, their parents forced them to doing medicine, and they were really not ever into it. And so what happens is you don't give your 100% into the field, and there's a lot of wasted years, a lot of wasted money, because you've taken all these biology, chemistry, organic chemistry courses, and your grades weren't good, for example, because you were never into it. And now you're just waiting because medical school is not taking you in, because again, you didn't really work that hard into it because you were never sincere about it. And so you did all of that just because your parents want you to do it, right? That's like the worst thing you can do. So go into it if you truly love the field, not because of pressure by somebody. Because like I said, even people that love the field and go into it, they get worn out as a physician after a few years. So imagine the people who were never interested in it, go into it, they'll get worn out even faster.
Awesome. Thank you so much, Dr. Suhail. Your comments have been incredibly insightful, and they really brought a new color to internal medicine and perioperative medicine and just the overall field of medicine. I just want to conclude now, and I want to thank you so much for joining with us. And we can talk after the call, once we end this call. But to our viewers, I just want to let you know that you can get your shadowing experience hours in the description below. And you can sign up to learn about our next event through the, if you opt in for the email newsletter, we'll be sending you updates for whenever our next event will be. And I just want to remind you to please like this video if you loved what Dr. Suhail had to say, and subscribe if you'd like to hear more. And I hope to see you in the next one.